person will lose these teeth in the end, obviously.
Hmm.
And what might not be quite as obvious is more what everybody else is walking around with in general is this. Everybody's got their teeth. The gums are just a little puffy, a little red. Okay, we do have some cavities here, but this is typically what it is, and you're not going to have any pain. And this is why only 40% of the population sees a dentist on a regular basis, and they don't know they have it going on because it doesn't hurt. So how does it relate to the rest of the body? Well, what's interesting is years ago, they were doing research on stroke victims and heart attack victims and everything else and studying the plaques that were in the arteries associated with these. And what they found was a bacteria in these plaques that's found nowhere else but in the mouth. And that's when everybody started opening their eyes to, okay, what can gum disease be linked to? So when you have gum disease, you have a much higher risk of a stroke. You have a much higher risk of a heart attack. Lung infections, uncontrolled diabetes, and one of the recent things I've been talking about a lot, and the OBGYNs are very interested in, is there's a link between gum disease and premature low birth weight infants. And they don't know why yet, but they're very intrigued on how this correlation is working. And as Dr. Dave already mentioned, there's other things going on related with cancer and everything else.
Can you explain why the ones before the premature low birth weight baby, uncontrolled diabetes, for instance, do they know why?
Some of them they don't. They're doing a lot of studies, even with the strokes and heart attacks. One of the things they've noted is the bacteria that's in the plaques that are in these victims. Basically, every day we have all sorts of bacteria that's in our mouth, and it's the one area of the body where, truthfully, part of the skeletal system, teeth, is exposed to the environment. It's the only area in the body that happens. And we're eating all day, we're taking all these foods, we got bacteria everywhere in the mouth, we brush our teeth, we floss our teeth, we got some gum disease, we bleed, and that bacteria gets into our blood system, and then also, of course, being transported throughout the rest of the body. And so with more research, we'll probably find some other things that it is affecting also. So this is one of the areas we'll continue to see, I think, in the future of dentistry, more issues with periodontal disease or gum disease and how it relates to other things going on in the body. But the research is still going on, and I'm sure it'll take years before we come up with definitive diagnosis for some of the things. So if somebody's ever pre-medicated in the past, this was basically why they did it. If they ever had to have a surgery or had a tooth pulled or anything that could cause bleeding, especially in the mouth, they took a large dose of antibiotics before they came in so that the bacteria that entered the bloodstream wouldn't enter the heart and attach to a leaky or faulty heart valve. And then next thing you know, they came in for a cleaning of teeth, and now they've got a heart infection and have to have open heart surgery or be in ICU on all sorts of IV antibiotics and everything else. My two daughters. So that's from a periodontal standpoint, a gum disease. That was really what I wanted to hit there, just to say that there's a lot of research going on. There is correlations to a lot of illnesses, and it's very important that an individual goes and sees a dentist at least twice a year, since that toothpaste commercial said that, just to make sure you don't have this gum disease. Knowing that 3/4 of the population has it, some form of it, and it's something very simple to take care of. It's hard to imagine that something as simple as a cleaning can help prevent strokes and heart attacks in low birth weight infants. And so the 60% of the population that doesn't see a dentist on a regular basis, and if there's anybody out there now listening to it, I hope this would convince you to go in and get an examination from your dentist. Is there any, before we move on to TMJ, do you want to answer any questions on periodontal disease?
Sherry, do we have any questions coming in?
Not yet, but that's a good reminder. If anybody does have a question that comes up during the presentation, on your blue panel on the side, there's a little question tab. If you open that up, you can type us questions during the webinar that we can either ask during or at the end.
All right, we want to move on?
Yes,
yes, sir. Let's do it.
So I'm going to move on to TMJ. TMJ is just a broad term for multitude of symptoms that we're about to go over. But what TMJ is, there's a lot of names for it. One is temporomandibular disorder, myofascial pain disorder, locked jaw, bruxism, clenching of teeth. These are all different names for TMJ. So what are some of the signs and symptoms of TMJ? Worn down teeth. Abfraction lesions. Abfraction lesions are little chipped out areas at the gum line on your tooth. So you might be able to put your finger there and feel these little divots near the gum line. Old theories from dentists used to say that you were brushing your teeth too hard and wearing away the surface. And that's not exactly true. What it is when we clench our teeth together, we can put so much force on our teeth. We can put as an average 160 pounds per square inch on our teeth that we literally bend the tooth. Half the tooth is the root that's in the jawbone. Half the tooth is what we see in the mouth. When we clench our teeth, we actually cause that teeth to flex and bend. And just like a stick, if you were to grab the ends of it and start to bend it, the stick splinters in the middle before it breaks. That's what an abfraction lesion is. You're putting so much force on the tooth, you cause the tooth to bend, and it splinters right in the middle, which happens to be there at the gum line, before it actually breaks. So if you have these little chipped out areas at the gum line, that would be a sign that you are clenching and grinding your teeth. That also leads to sensitive teeth. As the gums and the bone recede around the tooth, the root surface becomes exposed to air, and it's not the same as the enamel surface, so it's a little more sensitive. Jaw tightness or pain. So if somebody tries to chew gum and they notice that their jaws get tired after 5 minutes of chewing, this is a sign of TMJ. Also, is clicking and popping in the joint itself, which happens to be right in front of the ear. So the temporomandibular joint is actually this joint. When you open and you close, you feel right there. It has a disc of cartilage that sits inside there just like your knee. And most TMJ, when we talk about it, is a clenching and grinding and muscular problem. About 10% of all TMJ cases are actually a derangement or a problem in the joint itself, with the disc being displaced or torn, just like you can get a knee injury. Things that people don't realize that go along with this could be stuffy or ringing ears. So we have a lot of people that go to the ENT and then come back to see us because they did not have an ear infection. If you were to stick your finger inside your ear right now and push forward, and then open and close, you will feel your joint right there. So if you have a lot of inflammation in the joint, it's right up against the ear canal, and you get this stuffiness and sometimes ringing in the ears. And it is actually not a true ear problem, but a joint problem itself. Another thing that confuses a lot of people think they have a lot of sinus problems and a lot of sinus infections. The top teeth, all the roots of the top teeth, basically pregnate into the sinuses itself. And as you're putting all this pressure on your teeth and keeping everything inflamed and irritated, the maxillary sinuses also are inflamed. And so people think that they have all these sinus problems when it's an actual problem with the teeth and the clenching and grinding. And I'm going to talk about that more in just a second. The same thing with headaches, and this is one of the areas I love the most, and we'll talk about this for a while, from sinus headaches to tension headaches and even migraine headaches. 40%, hello? Can you hear me?
Yes, we can still hear you.
Okay. 40% of, there's studies out there saying that 40% of all migraine headaches have been related to clenching and grinding habits. So it's promising to think that if somebody's suffering from migraines, there's appliances we can give them that can reduce their migraines by up to 40%. If you know somebody that wakes up in the morning with headaches, I can pretty much guarantee you we can relieve all of their headaches with the appliance that we make that you sleep in.
Could you tell me a little bit more about that?
Sure. There's two reasons why people clench their teeth. One is a bad bite, and to not get too complicated, the mind is basically trying to create and find that perfect bite where all the teeth hit evenly. And so it rubs teeth together, trying to create it, pushes teeth in all the directions. So when your bite is off and unbalanced, you will have a tendency to clench, kind of like chiropractic beliefs. If muscles are out of balance, then you can have more back pain and everything else. The other reason why people clench their teeth is stress. Well, there's an appliance we make that addresses the bad bite. Something it's truly a diagnostic tool meant to be worn 24 hours a day. But most people just wear it at night when they go to bed and do most of their clenching